Sensorimotor psychotherapy. So, what is that? And how might I use that? You know, I'm doing a series of videos now looking at different types of approaches to mind-body medicine and to the management of trauma and stress, illness and complex health issues. And like many things in the physical therapy domain, the more I have studied, the more I think that actually there are so many things that overlap, and we could just stop arguing about the labels and who owns this, that and the other, and there's such a lot of overlap, and it's fascinating. If each person has their own little specific strand, and my way has always been to try to take and learn from as many different directions as possible, because there's always those little occasions where you think this is just the right nuance that this patient needs right now. Sensorimotor, well, that's sensation and motor, and psychotherapy. That's a more kind of where the mind meets the body therapeutically. So Babette Rothschild is really the originator of this work. It overlaps hugely with the work of Peter Levine, but it comes at it from a slightly more psychotherapeutic perspective, perhaps, than a neurophysiological. And it does embrace perhaps a little bit more of the psychological and developmental psychological perspectives in it. But where it overlaps hugely is about tracking physiology, looking at what's sometimes called SIBAM, sensations, images or impressions, behavior, affect or emotion and meaning, and looking at how those parts of every experience that we have, which is all of those elements, might be disturbed in some way, or to help maybe looking at one piece of that might slow us down enough to be able to process that and then see how it's relating. So for example, with a PTSD situation, we may have an overcoupling of some of those elements. So a PTSD war soldier might hear a loud car backfire and bang in his local hometown in England, where he knows it's safe, and within about 100 milliseconds, because that's how fast his nervous system will respond, in literally the blink of an eye, he will have perhaps flashbacks. He may have hit the deck and be panicking, hyperventilating, his body's tremoring, or he's gone into a freeze response, unable to move. He may have had responded as if he was back in Iraq or some place of a tour of duty, where he had experienced goodness only knows what events that were too much and overwhelming for his system. And so it may be that we need to use somatic experiencing, EMDR, neuroaffective touch, body psychotherapy approaches to be able to interrupt the process. But it does also use touch, and as a physiotherapist first and foremost in my background, I have really always found that touch is a very, very useful tool, and I champion the use of touch in trauma, and a lot of psychotherapists, unless they're suitably trained, this is forbidden, and there's a great taboo around touch. There are narratives that say that you interfere with what's called the transference by creating touch, and that there can be detrimental effects by making contact with your client as a psychotherapist. And I get that, and I think that that's there, it's real, it's in the room, there's a potential complication. But my experience is so often, whether that be developmental trauma and early years trauma, so often this is that there wasn't actually anybody perhaps appropriate touch or responsive attunement of a parent or a caregiver. And if we look at the statistics and the data around trauma, most traumatic events tend to happen in the absence of a benevolent other, that's Peter Levine's words, in the absence of some empathic person to be there with us at that moment, we are so alone, and that contributes significantly to the overwhelm. And therefore creating some kind of touch and a sensorimotor experience is so powerful in the reparative process. This stems moreover into neuroaffective touch, which I think really is, for me, probably one of the most wonderful blends of all psychotherapeutic and sensorimotor and body psychotherapy approaches that is out there right now. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. Don't forget to hit the like and subscribe buttons.